Corey Jacob. I'm currently the president of the Regina branch for the SIA. And we thought it would be a good idea to have a webinar around Lyme disease, as the ticks are out and it's quite a serious issue. And of course, we have someone who has experienced Lyme disease who can speak to us today. So we thought it would be a good opportunity, and are happy that Sherry is able to and willing to speak to the group. So just to introduce her, Sherry Roberts is a professional agrologist and past president of the Regina branch. She's also currently our provincial counselor in the Regina branch. And Sherry is here today to talk about her personal experiences in dealing with Lyme disease in recognition of May being Lyme Disease Awareness Month. So with that, Sherry, I will let you take it away, and then we will take questions when Sherry is done.
Thank you so much, Corey. And for those of you who've never met me, hello. I'm going to shut my camera off now just because I don't want to jeopardize my bandwidth here where I'm at. Yes, as Corey said, it's Lyme Disease Awareness Month, the month of May, and that's internationally. It's not just Canadian-wide, because Lyme disease is an international disease. And when I'm going to start off today with my disclaimer, and I want everyone to know today, I'm going to tell you my story and how Lyme disease changed my life. With everyone that's had Lyme, it will vary on how this disease manifests itself, how they struggle, how their body handles it, and how and if they recover. What I'm going to say is my experience. I am in no way, shape, or form representing the Ministry of Agriculture or the Saskatchewan government, and I put that disclaimer in there because for those of you who know me, I work for the Ministry of Agriculture as a crops extension specialist. But as I say, I am in no way, shape, or form representing the ministry today. And last but not least, some of what I will be sharing with you today will contradict current scientific understanding of this disease and how it is currently being treated within this province and within Canada and within the United States. And I put that out there because I know there's a lot of work going on with Lyme, but sometimes people's actual experiences are way ahead of science. And in my case, with my Lyme disease, the first two cases, I was way ahead of science. My story begins in Minnesota. That's where I was born and raised. I grew up on a farm in Elk River, Minnesota. It is now a suburb of Minneapolis, or they say a city. Back in my day, it was the country, and it's 50 miles north of Minneapolis. And we raised basically Hereford cattle. My dad had a commercial herd. I had a purebred herd. Our house sat on the top of a hill, and it was covered with oak trees. Our pasture had a peat bog in it, and we had reed canary grass, and we had all kinds of tall grasses and shrubs and bushes, which ticks love, and it was the perfect tick habitat. Little did I know what was going to happen. My first journey with Lyme disease began in 1988, and I say my first journey because I stated in publicizing this webinar that I have had Lyme disease 3 times. Some people will go through their whole life and never get it. Some will get it once. For some reason, the ticks like me, and I have had it 3 times. Now, in 1988, I would like to say that it was some miracle doctor, or that I found a tick that was suspicious, or that I got the classic rash that can sometimes happen with Lyme disease. It's called erythema chronicum migrans, but do not, I will say, do not count on necessarily getting that rash. Only 60% of people that are bit with infected ticks will get that rash. So the other 40% don't. And in 1988, when I was diagnosed with Lyme for the first time, I don't remember a rash. Hey, I grew up in the country. I was bitten by ticks all the time. Everybody that farms, anybody that does any kind of outdoor activity knows that getting a tick bite is basically, it's going to happen. I mean, no matter how careful you are, it's something that happens when you're outdoors. And how my case was first diagnosed was, my father died in 1980, and my mom and I decided to stay on the farm. My mom loved our farm, and she was having a bunch of health problems. And she was having horrible night sweats. Her body ached. She was tired all the time. She would forget things. She was absolutely, completely miserable. And what she said to me one day was, I'm going to try one more doctor. And if that doesn't do it, she said, I've had it. I've had it with my life. Well, she picked out the yellow pages, called up a doctor by the name of Dr. Kind. He was an infectious disease doctor in St. Louis Park, Minnesota. I took her to the appointment. She explained all of her symptoms. And he said, ma'am, I'm going to run a whole bunch of tests. And when you get done with those tests, if we still don't have the answer, then I'm going to have to refer you to the Mayo Clinic. But as of this point, I think, he said, from what you're telling me and describing to me, I think you might have Lyme disease. We'd never heard of it. And he said, but I also want you to know that when we run this series of tests, he said, you'll see on the list here, it was a great big full page, tick, 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 tick of all these blood tests. He says, I'm also going to run a syphilis test because Lyme disease and syphilis are cousins and they mimic each other. Well, my mom had been a widow for several years. There was no opportunity that the syphilis could be a possibility. So she kind of chuckled about that. And she said, oh, no problem. Go ahead. And he took all the vials. He sent her home with some other tests that she had to drop off and put in. And a week later, she got a phone call. And it said, Mrs. Borquist, your Lyme disease test came back positive. We want to put you on antibiotics. Okay. She was fine with that. Hey, anything to get me feeling better. And her and I got talking and I said, I have a lot of the same symptoms that you have. I wonder if I could have Lyme disease because I was actually outside more than she was. At the time I was working as a weed inspector. I was also teaching courses on custom pruning of fruit trees and shrubbery and a bunch of landscaping stuff. And plus working on the farm, mowing all the grass, keeping things up. I actually felt, hey, if she could have this when she's not even outside that much, maybe I have it too. So as I had gone to the same doctor visit with my mom, I had met the doctor and I called him up and I said, I would like to get a Lyme disease test. My mom came back positive. We live in the same household. We have the same type of conditions outdoors that we expose ourselves to. In fact, I expose myself to it even more. And what he said was, I'm not so sure. We really haven't seen households where there's been more than one person coming up positive with Lyme disease. At that point, I was pretty desperate and I darn near, I begged. I said, please, doctor, just give me the test. I mean, I have insurance. It can cover the cost of it. And they said, okay, fine. Come on down to the clinic. We'll draw blood when we come to see your mom's repeat appointment in a week. So we went down there. They drew my blood. A week later, they called me back and they said, you have now tested with the highest titer test, which is the blood test that they do in regards to Lyme disease that our clinic has ever had. We want you to immediately get on antibiotics. And I thought this was really weird. Lyme disease, I mean, Minnesota is not really known for having deer ticks. There are some around, but in my lifetime, I have never, ever pulled a deer tick off of me. So with my mom coming up positive, myself coming up positive, I was baffled. I mean, we laughed all the way home about Lyme disease because Lyme disease is in the United States is known as a disease that affects the people out in the Northeast. It's named after Lyme, Connecticut, in fact, which is where the first cases were discovered. So we thought, what the heck? This is Minnesota. Little did we realize that Minnesota had become a hot spot for Lyme disease, just like the Northeast, Minnesota, Wisconsin, North Dakota, and Iowa, Minnesota being the top state at the time that was seeing a flourishing number of Lyme disease cases. And what I was showing for symptoms at that time with my first case was fatigue. And when I say fatigue, I mean fatigue. I mean, no amount of sleeping could make you feel less tired. I was dealing with a bunch of joint pain and swelling, particularly in my larger joints, my knees and my hips. But I just kind of blew that off because I'd been kicked in one of my knees by a horse when I was little. I'd done a lot of bike riding. You take falls and things like that on a farm. I hadn't paid that much attention. I hadn't put all this together. I also was dealing with headaches. And the headaches would start at the back of your spine and they would work up the back of your head. And what I didn't realize is Lyme disease as a component where it hits you neurologically. And I was actually dealing with brain swelling at the time. It was causing my brain to swell. And in some cases, some people do end up with encephalitis because of Lyme disease. I had a light sensitivity. I couldn't go in a room with fluorescent lighting or my eyes would start to burn and hurt. Weird symptom. The other thing was forgetfulness. And I don't mean just, oh, you forgot somebody's name or somebody's birthday. I would literally forget where I was going. I had this brain fog and I would talk and deal with difficulty in word recall. I would stumble if I would start walking. I would go on hikes and things, and I was real stumbly. And the gentleman I was dating at the time, he couldn't believe it. He says, "What the heck's happened to you? You used to be able to move through a woods like nothing, and now you're stumbling over roots here and there and everything else." And the biggest other thing that I noticed was I was having trouble concentrating, particularly when I was reading. And I love to read. I've been a reader since I was a little kid, and my reading proficiency is outstanding. But I would read a paragraph, and I'd have to go back and reread it, and reread it, and reread it, and there was no comprehension between what I was reading and what was on the paper. And to me, this was all so foreign. I knew something was wrong. And when it came back, yes, you're positive for Lyme disease, I knew that I had at least gotten a diagnosis for what was happening to me. I did all the researching that I could think of. I joined a Lyme disease support group in Minneapolis. When you come down with a disease like this, you want to know as much as you can, as fast as you can, to try to get yourself back on your healing journey. They prescribed to me initially doxycycline capsules. I would take 200 milligrams in the morning, 200 milligrams in the afternoon, and 200 milligrams in the evening. There are two different kinds of doxycycline out there. There are the little green ones, and then there was also red ones. And one was more effective than the other because of the filler product that they have in it. So sometimes when they put you on an antibiotic, question and say, "Hey, I don't seem to be doing the way I used to do on this drug," or, "Can I try something else?" Well, when I was initially diagnosed, my doctor said 6 months of antibiotics and I should be back to normal. Well, that was before the politics of Lyme disease struck. I was in my 4th month of doxycycline, feeling much better. Oh, the pain was gone, the fatigue, my joint swelling was just periodic. The concentration, I could read something and understand it. The headaches had gone. I was thinking, hey, I'm getting better here. And then I went to renew my prescription and he said, "Well, that's all you need." And I said to the pharmacist, I said, "What do you mean?" They said, "Well, no, the doctor's refusing to renew your prescription." And I didn't understand. And I went back home from the pharmacy and I called up my doctor and I said, "What's going on here? I've been on this now for 4 months. You said originally 6 months of antibiotics." And he said, "Well, yeah, but the medical community has kind of reevaluated this disease and we're not so sure if it's healthy for you to be on an antibiotic that long." And I thought that was kind of a joke because earlier in my 20s, I had been on tetracycline, which is a cousin to doxycycline, and I had been on it for 1.5 years for acne, and nobody raised an eyebrow about that. But now all of a sudden I have a disease that's majorly affecting my body, and they're saying, "Oh, no, 4 months is enough." Well, I begged and I pleaded, and then he gave me some amoxicillin for he said, "Well, we'll put you on amoxicillin for 2 months. We'll see if that helps out because sometimes you need to switch antibiotics. The bacteria get used to the antibiotic and the effectiveness wears off." So he switched me over to amoxicillin and I was on that for about a month and my body reacted to it very badly and I started having reactions and I had to stop it. And when I stopped the amoxicillin, a bunch of my fatigue came back, the headaches, the confusion, the forgetfulness. And I got back on the phone and I begged and I pleaded, and my doctor was willing to give me a few more months of doxycycline. Now, in the meantime, my mom had also been taking doxycycline. They prescribed it to her for 4 months. And at the end of 4 months, they stopped. They said, "You're fine. Any other symptoms that you have from this point on are all immune system responses to the disease, but the disease is no longer in your system." This is what they told her. I was lucky. I had a doctor that believed differently. And he continued to treat me. And after it was June, I stayed on an antibiotic until June. And it was my last visit with my doctor. And I went to him and I said, okay, now, doc, I said, I believe I've got this disease whipped. And he says, we think you do too. I said, but I'm in an extremely high risk job. I said, I'm a weed inspector. I'm outside all the time. I'm walking in grass. I'm looking at weeds. I live on a farm. I teach horticulture and I'm out trimming bushes and shrubs and walking people's lawns and everything else. I said, what about this? You know, do I need to switch my career and get into a classroom so my risk isn't as great? And he looked me square in the eye and he said, no, I don't think so. You had such a severe case. We don't believe that you can get this disease again. Now, back in the 80s, this is what they believed. And all right, I'll believe this doctor. He's one of the top infectious disease doctors in Minnesota. He comes out of a very prestigious Park Nicollet Clinic. He must know what he's talking about. But I did my precautions. I sprayed down with off every time I went outside. I taped up the bottom of my pant legs to keep the ticks from crawling up my legs. And the minute I got home, I pulled off those clothes and put them into the wash machine. I was religious about following this regime because a little bit in the back of my mind, I thought, well, I really don't want to get another tick bite. You just don't know. And then came the day, July 21st, 1989. I was on my way to a fair booth that I was putting on as a weed inspector. And I noticed a weed in the side of the road that I didn't have in my display. And I did something really dumb. I got out of my truck, I grabbed my shovel, I grabbed a bucket, I went and I dug up the weed. But before I walked into those weeds in the ditch, I never sprayed down. I never put on any tape. And I went to the fair for a whole day. Came home that night. I was so exhausted after being out in the heat all day. I basically ate supper and went right to bed. I got up the next morning and lo and behold, on my back side, my left cheek, I found a tick. And when I pulled that tick off, I thought, oh my God, I sure hope this doesn't have Lyme disease. And within 3 days, the following symptoms came roaring back. I got a rash that looked just like this at the tick bite site. The fatigue came back. The joint pain, the swelling, the flank pain, the headaches returned. I was encompassed with this deep, deep depression with this second case of Lyme disease. I had sleep issues, the light sensitivity, floaters in my eyes. Basically, everything came flying back, and I couldn't believe it. I absolutely could not believe it. My infectious disease specialist was no longer seeing Lyme patients. He said, oh, you can't. I called him up and I said, I got bit by a tick again. I need to go back on antibiotics. And he literally did not believe me. He did not believe that I could have gotten Lyme disease a second time. Now, what saved me was I had networked with some people, the first case through the Lyme disease support group in Minneapolis. And one of them had mentioned a doctor in a town next to us in Princeton, Minnesota. And I got his name and I made an appointment and I made this appointment. I still had the rash. And like I said, not everyone will get a rash. 40% of all Lymers won't get a rash. So don't necessarily consider that to be the epitome symptom, although it is. If you get that rash, that is the definitive that you have Lyme disease. And the thing is, when I took my tick off, some little thing in the back of my mind, I took that tick and I put it in a bottle. And I thought, just in case something happens, I want this tick so it can be tested. Well, like I said, all my symptoms came back. And this was in 1989. For the next 10 years, I would battle Lyme disease. I would not only have had the fatigue and the joint pain and the swelling and the flank pain, and the headaches that were so bad, you thought your head was going to explode. And like I said, it was because you actually experienced swelling in your central nervous system. And it was the bacteria were trying to fight to invade into the soft tissue of my brain, because that's what they do. They go into the soft tissues of your body. I fought depression like nobody's business. I was on antidepressant after antidepressant after antidepressant. The only problem was they all made me suicidal, so I couldn't take them. Finally, after the 8th antidepressant, my doctor said, well, we got to try something here. He says, living with this depression, it's not good for you. And I said, Doc, have you ever taken any of these drugs? And he said, no. And I said, maybe some people can handle them. I said, but they don't make me feel like me. And I said, all I want to do is go out and kill myself. So I said, please don't make me take these. Well, he relented and allowed me to deal with my depression in other ways. We went on to, I had sleep issues. Some days you slept your whole entire day and night away. Other times you couldn't sleep. I'd be awake at 5 o'clock in the morning, and my mom had this same issue. So we became movie buffs. I can probably tell you any of the classic movies of the 60s, 70s, and 80s. I've probably seen them and seen them more than once, but it was our way of being able to cope. The light sensitivity in the floaters, I went to more than one ophthalmologist. He said, you got floaters. Yeah, no doubt. I got floaters. I know that. Well, why? I said, well, they showed up when my Lyme disease showed up. Okay, we understand that. Yes, floaters and Lyme disease go together. Forgetfulness. The forgetfulness that I had the first case was nothing compared to the forgetfulness of the second case. I started having a checkbook when I was 15 years old. It's now 1989. Okay, I'm now 39 years old. I've had a checkbook for 14 years. But I would go to the grocery store, get to the checkout counter, and literally forget how to write out a check. I would stand there, and luckily I had really, really good checkout ladies in the town I lived in. And I would stand there and I'd have to tap my pencil to try to remember how to write out that check. Sometimes I couldn't, and I'd have to hand it to the checkout lady and say, could you fill this out for me? The brain fog would get so bad on some days. I had a colleague come to visit me, and I had worked with this man for 3 years, and he got out of his vehicle, and I went to the door of my house, and I looked at him and I said, I know I should know you, but I don't know you. And that was the real stunner for people. We talk about Lyme disease. Oh, well, take a few antibiotics. Like I said, my second case, I fought for 10 years. I had difficulty in reading. I had to finally give up reading. I couldn't read anymore. I would read the same sentence over and over and over again, and it made no sense. The stumbling continued. The fatigue got so bad that I would go out to do chores and I'd have to sit down from the time I walked to the house to the barn, I'd have to sit down and rest. Then I'd have to go and feed my horses, and then I'd have to sit down and rest again before I walked back to the house. My heartbeat, I developed a heart problem. They call it carditis. My heart would take off and race, so I was put on a heart medication, and I took that for over 20 years before that problem finally resolved itself. My asthma that I'd had as a kid came back. I never went anywhere without an inhaler. And the funny thing, and I thought this was just something to do with me, but every disease maybe has a silver lining, and for some ladies, maybe not. But Lyme disease also gave me breast enlargement. And what happens is it's a soft tissue disease, and the bacteria burrow into all the soft tissues of your body. Well, they burrowed into my breast, and my tissues hung down more. So I went from being a 36C to I'm a 44 double D. So it's the only positive thing I could think of about it. And the funny thing was, I thought maybe it was just me, but I got together with a bunch of ladies in our Lyme disease support group one day, and I said, ladies, I want to ask you all a question here. And they said, what? I said, have any of you noticed breast enlargement along with your Lyme disease? And every single solitary person said they had at least gotten 1 cup size bigger. So that's the only positive I could think of, and if I want to relate to this disease. Now, if you listen to standard scientific literature and even the entomologists here in Saskatchewan, I've talked to several of them, ones with AAFC and even with the province here. The only tick that can transmit Lyme disease is Ixodes, and it's a deer tick. Well, I told you I kept my tick with my second bite. I never did find a tick with the first bite or the rash, but my second bite, I kept the tick. I sent it away to the University of Minnesota after my doctor gave me my diagnosis of having Lyme again after he saw my ECM rash, classic ECM rash, as he said. I sent that away and I said, I took this tick off of me. I now have a doctor documented ECM rash. Would you please test this tick for Lyme disease Borrelia? And that's what you call them. Borrelia burgdorferi is the name of the bacteria that causes this disease. And here was a chance I saw to find out for sure, do American dog ticks carry Lyme disease? And instead of testing that tick, that researcher threw it away. And I spent the next 5 years talking to researchers about what ticks carry and spread Lyme disease. I read scientific paper after scientific paper after scientific paper. And I am living proof that American dog ticks can give you Lyme disease. And I'm going to refer you to this paper here. It's called Ability of Lyme Disease Spirochete Borrelia burgdorferi to Infect Rodents and 3 Species of Human Biting Ticks, Black-Legged Tick, the American Dog Tick, and the Lone Star Tick. And this was written way back in 1997. And the conclusion that came from it was, as they were doing their work, they state, perhaps this explains why questing Dermacenter variabilis, and questing means they're looking for food, are found occasionally to be infected in nature. The ability of Dermacenter variabilis to transmit Borrelia burgdorferi, which is the bacteria that causes Lyme disease, indeed requires further investigation as an important public health question. So I'm here today to say, even though the majority of the scientific research out there at this point says that American dog ticks cannot transmit Lyme disease, they can, and they can on occasion. They are not the efficient vectors that the Ixodes deer tick is for transmitting it, but don't ever discount it, because not only did I get and take off and identify an American dog tick on my second case of Lyme, but for my third case of Lyme disease, I took off and identified an American dog tick, and that case happened here in Saskatchewan. And I'll talk about that a little bit further in my presentation. But this is the biggest, most controversial thing I will say today, that and the type of treatment that I received for my disease. So buyer beware. We are all in a research-based occupation. Research it yourself. They cannot definitively say it does not carry it. In fact, it can carry it. They do say that it is not an efficient spreader. Well, my odds were such that I found out that I can get it from a dog tick, and I did get it from a dog tick. More research is definitely needed in this area. And what most people don't realize is there's different strains of Lyme disease. Different ticks carry different strains. And William Burgdorfer, the gentleman that actually discovered the disease, that it's named, that Lyme disease is named after the bacteria, he works out of Rocky Mountain Labs in Hamilton, Montana. I called up the lab because, of course, my case, I was bit on the job. It ended up in the workers' compensation nightmare system. So I had to prove that this tick carried Lyme disease. Well, back in the late 80s, early 90s, even now, it's an uphill battle. But I called Rocky Mountain Labs where the bacteria was first discovered, and I talked to a researcher there. And I said, sir, this is my problem. I said, they're telling me that I could not have gotten Lyme disease from a dog tick. I said, what do you think? And he said, I'm going to tell you now, after all the research that this lab has done, that any insect that bites where there is a transfer of saliva and blood can, on occasion, give you Lyme disease. This was really hard to swallow, because living in a state like Minnesota, where the land of 10,000 lakes and 1 million mosquitoes. But in my Lyme disease support group, I know a person in Wyoming, she got her Lyme disease from a yellow jacket. It was documented. I had mine from a dog tick. My husband, who also had Lyme disease, he got his from a tick, a different variety of tick over in the Caucasus Mountains. Each one was different. The symptomologies of each one was different. And like I said, tick beware. My husband, Janelle just put a comment out there. Her uncle got one from a spider bite. It's true. And like I said, this whole meeting today is to try to make your level of awareness greater about this disease, because it is here. It is here in Saskatchewan, and I'll talk a little bit later more on how, besides the fact that I got a case of it. But anyway, my husband's symptoms were different than mine. He had a rash on his stomach where he took the tick off. He had extreme bone pain. He said it felt like someone was trying to break his bones. And he was 6'3". He was short bodied but long legged. And he said he was driving home from PA one day, and he said the pain became so intense in his legs that he thought someone was standing on them, hitting him with a sledgehammer. The pain was so bad. Well, in the beginning with this disease, they very seldom ever talked about bone pain. Now, if you read the literature, they found out that yes, the bacteria do invade the bones, just like the cousin syphilis. And that's what people have to understand here. This disease is a cousin to syphilis. It does a lot of the same things that syphilis does to you. It infects your brain. It infects your bones. It makes you tired. And if you read some of the literature says it cannot be sexually transmitted, but all of the Lyme disease doctors all warned all Lyme disease patients to take a lot of precautions in any type of sexual encounter they had, because it is not proven conclusively that this disease cannot be spread sexually. I have also been told I cannot give blood. The thing with Lyme disease is they cannot ever tell you whether you are over it. It goes in dormant in your body. And we'll talk about that a little bit more. My other husband's had symptoms of fatigue, headaches, and for you men, he had testicular swelling. Now, he got bitten over in the Caucasus Mountains. He was working as an international agricultural consultant for the Russians at the time. They said, yes, Lyme disease is here in Russia. We do not treat it very aggressively, though, but we will line you up with doctors in Germany, and they will get you cured. My husband said, no, thank you very much. I will go back to Canada. I'm sure that I can get it taken care of there. He returned to Canada, and he stumbled and had one heck of a time. He went 1.5 years before he could ever get a doctor to take him seriously. And luckily, a doctor from South Africa moved into his community. He went to see the gentleman. He said, this is what I'm dealing with. I believe I have Lyme disease. He said, well, I don't know a whole bunch about Lyme disease. He said, but I do know about relapsing fever. It is also in the same family as Lyme. And he said, I will help you, but you have to do what I tell you to do. And he put him on a strict diet, and he put him on doxycycline, and he put him on a level of doxycycline that was higher than what the medical community prescribed at the time. And my husband got well. He beat his Lyme disease, and he got his life back. And when he went back to his doctor to tell him about it, his doctor said, well, do you mind if I talk about you at a conference? And he said, no, that's fine. And this said doctor went and spoke with a colleague of his up in his office there. in northern Minnesota, and the gentleman said, if you dare bring that up because of the fact that you were using higher dosages of doxycycline than should be prescribed, he said, I will put you in front of the medical board. So I want people to understand this disease has a whole lot of politics involved in it. This is the doctor that saved my life, Dr. Dean Myers. He was just a general practitioner, and he fought the system for me. He believed that you had Lyme disease until you became symptom-free. Lyme is like COVID. There's two camps. There's the camp that you have your initial 30 days, some say 2 weeks, some say 30 days, some say 2 months of antibiotics, and you are cured. The bacteria no longer exists in your body, and any other reaction you have is just an immune response that your body has built up. And then they start putting you down the trail of giving you immune suppressor drugs and everything else. And they tried to do that with me. And thank goodness this man listened to me. And we went off the immune suppressant drugs. I went back on antibiotics. And he said he could have made his whole entire practice out of Lyme disease patients. Lyme got so bad in the late 80s, early 90s. He said, in fact, he had one patient come in, and the only symptom this person had was he had tennis elbow. And he had the fatigue, and they couldn't figure out anything. And he says, well, let's give you a Lyme disease test just out of the blue, and darned if the guy didn't come back with it. So you don't necessarily, everybody's immune system responds to this disease differently. And so don't always just say, oh, well, you know, I don't have this, I don't have that. In fact, if you go online and you Google Lyme disease symptoms, there's a list of about 100 symptoms that Lymers and really outstanding Lyme doctors have come up with. But back to the political thing, there's the camp that you treat until you're symptom-free versus the camp that you treat for a short period of time with antibiotics and the disease is gone. This disease has become so politicalized in the United States of America because it is extremely expensive to treat. I had 3 treatments of IV antibiotics with my second case. The first treatment was 6 weeks. The second week was 4 weeks. And the third week that I have was another 4 weeks. They weren't all combined together, but over the 10 years that I had Lyme disease and I fought it. Each week of treatments was $3,000 a week. So start adding that up. When I wasn't on an IV antibiotic, I was on an oral antibiotic. And people say, oh, you can't be on antibiotics for that length of time. I was on 10 years of antibiotics in order to get over this disease. And it was the 4th IV antibiotic treatment that I received after I had a major surgery that actually killed off the disease. Because what happens with Lyme is it goes dormant in your body. It's like syphilis, like I said, they're cousins. And it puts an encapsulation over the bacteria. And in order for antibiotics to kill off that bacteria, it has to be in a replicating state. So when it's hiding out in this dormant state, an antibiotic won't work against it. And this is why it's one of these diseases that lingers and lingers and lingers in people's body. Now, the other camp says, oh, no, that's impossible. But yet we have scientific proven that the Lyme goes dormant and goes encapsulated. That's no question on that. So what happened was I had to go in for a major surgery. My doctor nailed me with IV antibiotics after that surgery. For some reason, I was given a specific anesthetic, and they've now proven there are certain anesthetics that will bring the Lyme out of dormancy. I sometimes say God intervened on this, and I was given the proper anesthetic. I was given the blast of antibiotic treatment. And after 10 years of suffering, I was able to get my life back. I can't stress enough what this disease does to you. I battled for 5 years the system to prove that I actually had a legitimate disease. They tried to label me with chronic fatigue syndrome. I got labeled with fibromyalgia, all diseases that are kind of a catch-all in the United States that they don't really do a whole lot for you, and they certainly don't give you antibiotics to treat it. I was labeled, my mom actually with her Lyme disease, she ended up being labeled with somatization disorder, which for those of you who don't know what that means, it was that she was had doctor seeking behavior and that she really didn't have anything wrong with her, that she was finally diagnosed as having a psychiatric disease instead of the Lyme disease. And 5 years into my diagnosis with Lyme disease, after I fought my battle with workers' compensation, I got the final letter in the mail. As of that point, I had lost my business and I'd had a successful consulting business. I'd lost my relationship of 5 years. Sorry, gentlemen, a lot of times relationships don't, it's a gem of a man that will take on a woman that's disabled and deals with pain every day in her life. And for those of you who do it, I give you the biggest, utmost gold star and special place in heaven. But the 5th year into my disease, after I was told that I was on the system that I needed to be on, which happened to be the welfare system and food stamps, I attempted suicide. Now, this disease, I know part of it was the psychological trauma of the disease. The other part was what it does to your life. And that's why I'm here trying to warn people to be careful. Be careful out there, because a simple tick can turn your life upside down. Now, I attempted suicide and it didn't work, but in 1998, after battling her Lyme disease for years and years and years and not being able to get any more antibiotic treatment, my mom did take her life. She shot herself one Sunday afternoon. Sorry. And she left a note and she said, "I'm sick and tired of being sick and tired. The doctors won't help me and I've had it." So this disease is nothing to play with. It's nothing to scoff up. And I can tell you it is here in Saskatchewan. In 2019, I took a tick out of my hair, put it in a bottle, because that's what I always do with every tick that I take off my body. I put it in a bottle of alcohol. I had a young boarder living with me at the time. This was just before COVID had hit, just as it was starting. And my husband passed away 5 years ago, so I was by myself, and I thought it would be worthwhile to have someone living with me just in case COVID came along. Well, COVID came along later, but in the meantime, Lyme disease hit, and I pulled the tick out of my head. The location where it's at seemed kind of pussy and infected. I thought, I'm going to keep this tick, and I put it in my bottle with all the others, and I didn't pay a whole lot of attention. I mean, you take ticks off. I knew it hadn't been on me longer than 24 hours. I knew it had to have just gotten on me that day or possibly the day before, the evening before, because I take my dogs out for walks nightly. And a week later, I'm laying in bed and my whole body hurt. Every single joint was screaming. I had a headache and I was so tired. And I thought, oh my God, I've got Lyme disease again. I got on the phone to my doctor. She was out on mat leave, but I talked to a really nice doctor, and I said, I have Lyme disease. I need to get on an antibiotic right away. And he said, well, you know, Lyme disease isn't very common in this province. How do you know you have it? And I said, because I've had it 2 times before. And I said, the symptoms are back and I know what to look for. It's like being pregnant. Now, granted, I've never been pregnant before, but if you talk to some ladies that have been, they will tell you, you know when you are after a certain point. The signs and symptoms are all there. I was lucky. My doctor gave me 15 days of antibiotic. And the other thing about Lyme disease, when you start on an antibiotic, you start killing off the bacteria, and the bacteria release a toxin into your system. And that toxin makes you sicker than you'd been before. And it's called a Herxheimer reaction. You can look it up. And the Herxheimer reaction is the definitive, yes, you've got Lyme disease, and yes, this antibiotic is killing it off. And I'll take questions when I'm done here. So after 2 weeks, I called my doctor back up and I said, listen, I said, I need 2 more weeks of antibiotic. We all know that 2 weeks is not enough. I said, I would be satisfied at 30 because I caught this so quick. And he said, yes, I will give you 2 more weeks. And I took those 2 weeks and I have been symptom free since that point in time. But one other thing, going back when I went to pick up my antibiotics the first time at the pharmacy, I said to the pharmacist, I said, could I get some, at this point, you could still get Tylenol 1s over the counter. I said, could I get Tylenol 1s? And he looked at me and he said, why? And I said, well, I have Lyme disease. And I said, I'm going to get a Herxheimer reaction. And I said, it's going to make my body hurt so bad. I'm going to wish to die. And I said, I need something to kill the pain. And being pharmacists, they were well aware of Herxheimer reactions and they had no questions or qualms about giving me a bottle of Tylenol number 1s. Granted, the Herxheimer hit. Yes, I took the Tylenol number 1s, not that many, just enough to dull the pain and get me through the worst of things. It's not a disease to play with, I'm telling you that. This map was produced in 2015. It said in the next 30 years, this is what's going to happen to the tick population. As climate change occurs to us, all those tick populations are going to move, and we already know that. That's proven. The people that study ticks in this country are seeing species of ticks that have never been here before. I don't think it's just climate change. Look how the incidences in the United States have grown. Now, they dropped down here, but part of that is the COVID problem. People weren't looking for it. They were staying home more. And the other part is, as this disease has continued to grow in population, they feel that there's 10 times the number of Lyme disease cases in the United States as this graph represents, because people are not aware of the disease, and doctors in the naysay camp convinced them that they have something else. I have stories when I had my first case of Lyme disease of people that were in the Northeast that had been put into nursing homes with Alzheimer's and dementia and all kinds of other treatments. The doctor said, hey, let's do a study. Let's go give these people antibiotics. They gave those people antibiotics, and guess what? A lot of those so-called dementias with no life left except to look staring at a wall were able to get up and get back on with their lives. It's a controversial disease, but it takes a lot of time and money and research, and it's not one of the top priorities, unfortunately. This is why I say the ticks are here. We're a major flyway. Where I live in Glen Avon, it's a major flyway. I have herds, I have thousands of geese, not so much now because of the avian flu, but they're down here. They're picking up infected ticks in the United States. They stop to feed every night. They stop in fields. They go feeding. They pick up ticks. And what? There's somebody at the border service saying, yo ho, geese and ducks, you got to drop your ticks before you fly into Canada. No, they're coming on with ticks. So are the songbirds. They say that they want to blame the deer as the #1 carrier of Lyme disease, but in all reality, it's actually mice that are the biggest carriers of it, and then we'll put birds on that second. So to say that it's not here in Canada is not looking at the facts, and it's not being truthful. Here's the Canadian cases of Lyme disease, reported from 2009 to 2021. In 2019, in Saskatchewan, we only have 2 reported cases. And those were people that traveled. Well, guess what? I never traveled anywhere. I was a reported case in 2019. That's not me. End of comment. Now I will take questions. And anybody that wishes to contact me, this is my private email. I would be more than happy to correspond with you. I know there are others in this audience that have dealt with Lyme disease. I think Barry's here, he's had it. There are other people in this province that have had it, and their stories are different than mine because they've dealt with the Canadian medical system, and the Canadian medical system, in order to prove a case of Lyme disease, is definitely different than the United States. So I'm sure that we could have more people coming on and talking about this disease, but I just wanted to bring it to everybody's attention. And with that, I will stop sharing and I will take any questions.
Excellent. Thanks very much for that, Sherry. I think it's, sounds like a very difficult disease to deal with and to live with, as you have said, but it is a bit of a positive that a person can overcome it with treatment, as you have said and shown as well. So, but definitely difficult to deal with from what you were describing. It sounds sounds like agony actually to deal with it for that length of time. But anyway. If anyone has any questions, please raise your hand or put them into the chat, and we will fire away at Sherry if anyone has any questions for her. I also want to say thanks, Sherry, for sharing, because some of those are difficult things to share with the group as well.
One thing I forgot to mention is, in my second case of Lyme disease, I went through an extensive set of psychological testing to figure out what the disease had done to my brain. And what they were able to conclude is that it, as I said, it affects the soft tissues in your body, and it went after the synapses in my brain. So my brain will misfire. And in doing that, even now to this date, they felt at the time that my brain would repair itself, but it hasn't. So I compensate for that and I hide it. If anyone ever has heard me speak a lot, they'll see me sometimes search for words. I mean, my colleagues here in the office, they're sweet gems. There's times when I want to say, did you look in the file cabinet? And the word file cabinet won't come down. So I point to it and they'll give me the word. I mean, they're that sweet and that darling. They understand the issues that I deal with. But if you ever hear me speak anytime and I hesitate and search for words, it's the brain disease. And the other thing is, I have a terrible tendency sometimes to interrupt people. And I do that because thoughts fly through my brain so quickly that if I don't all of a sudden just jump on it, it's gone. And there's nothing I can do about this. And right now I've asked for an updated evaluation, and I have been referred to a dementia clinic to do additional studies on this. So it hasn't all repaired itself. My heart condition did repair itself. I was able to go off of my heart meds, and I do deal with an awful lot of arthritis. I don't have a pain-free day ever. It's just a level of how much the pain is. So.
Okay. In the chat, we just have Janelle just saying thank you very much for sharing your journey with Lyme and making people more aware. There is one question from Kathleen. It's quite long here in the chat. So if mice can carry it, then it could be assumed that the fleas from the mice could carry it. If a house has mice, then the people could get the disease from the mouse fleas.
I don't know. There are reported cases that fleas have transmitted it, but it's more likely that those mice are going to bring ticks into your house. I would be more worried about that than the fleas. And certainly, a lot of people I know out east in northeastern United States, and even in Minnesota, they've gone to treating their yards, with tick products. They'll spray to try to keep the ticks down. If you want to do an organic method, I would certainly get myself some guinea hens or some geese or chickens. They're some of the best tick eaters that around. And for me, with my dogs, if you have dogs that come in the house, definitely get them on some kind of a tick control. I know I've used the drops. I now use the pills that are good for 30 days. But yes, if the dogs will bring the ticks in, and then all of a sudden they're on you. So.
Okay, thanks, Sherry. There was just a follow-up to that with Kathleen just saying that RE, the reported cases, they refused to report mine because they said they couldn't check for it and that we didn't have it. I was at Assiniboia for 5 years and I totally feel that I had it. We always had lots of geese around our acreage 2 times per year. I feel that both of my parents and my brother could have gotten it from our acreage too. Our one dog had it. He had the classic bull eye, and I feel that it was what might have recently had caused the dog to pass away.
Well, what's funny is down in Montana, of all the 50 states, they used to claim that there was no Lyme disease in Montana. And every time I was a vocational agriculture teacher down there for several years, and I would go into the vet clinics and I'd ask the vets, have you diagnosed any Lyme disease? And they'd say, oh, we diagnose it all the time in dogs. Well, if dogs are getting it, people are getting it. It's just, if you don't look for it, you're not going to find it. And unfortunately, there are people in this medical community that they don't want to look for it. They don't.
Okay, fair enough. Two more questions here. So one, actually three more now, but is there something that makes some people more prone to Lyme disease?
Well, of course, the more you're outside or the more you're around animals, I think you increase your odds. I know it's really funny. There are now some research studies out there that say certain blood types are more attractive to certain mosquitoes for getting bit by mosquitoes. So there could very well be a link that certain people give off certain, I don't know, auras or scents or something that make you more irresistible to ticks. I don't know if that work's been done, but I do know that it has been done with mosquitoes. And type O's are more attractive to mosquitoes, and I happen to be a type O blood type. So
Okay. Okay. Maybe as research progresses, there might be some other discoveries found with it, I guess. Yeah. Yeah. So, a question from Shannon: what is the other disease that Lyme disease is misdiagnosed as? Chronic fatigue, and I think was it fibromyalgia?
Yeah, fibromyalgia is the other one. Yeah, and I was both dubbed with both of those diseases, and like I said, the thing is with fibromyalgia and chronic fatigue disease syndrome, they no longer have to give you antibiotics. And they just say, well, it's your body's immune response to having had the disease, and we can give you some immune suppressant drugs and help you with some NSAIDs for the pain, but you're out of luck on getting any more additional treatment that might actually help you.
All right. And then just two more comments, one from Kathleen. Two of my neighbors had tested positive, but had to get tests done in the United States.
Yes, like I said, Canada has a different system of testing. You have to test positive twice for two different types of tests. You have to test on a titer test and on an ELISA test, which is, depending on how your sample of blood is handled and everything else, it becomes very difficult for somebody to come up positive on both of those. So yes, oftentimes people do have to resort to going to the States. So.
Okay. And just one last comment from Christy Wolf saying, thanks for sharing, Sherry. Very informative and also terrifying.
It is, and I don't mean for people to scare anybody, but as lovers of the outdoors and people in agricultural occupations and outdoor occupations, just be aware. It's like anything else. I mean, put your tick spray on. Tape up your legs. I know it looks a little weird, but you certainly have to take the precautions. And like I said, because I got careless, I got my second case that took away 10 years of my life. I was legally disabled for 10 years. I lost 10 years of working time, and now that means that I have time to make up. So yeah, it's not worth it. Take the precautions by all means, and they're there. Use the tick sprays, get your animals treated, and be careful, and watch your kids and your spouse, because we all know, sometimes men aren't as careful as they need to be when they go out there. They just are in a hurry. So ladies, everybody watch out for each other and do tick checks. You can make that a fun part of your relationship, those tick checks, because it's very important. A tick can crawl in the tiniest little space and get through a little piece of clothing. But if you've got somebody there to check over your body, or I have a full length mirror, and I look myself over every night, because it doesn't take much for a tick to get on you and hide. So.
No, good points there. One comment from Jeffrey just saying that dog ticks have been fully established as far north in the province as North Battleford.
Right.
They're here. Just I guess awareness is the main thing, like you said, which is good for us to be just awareness and people taking precautions. Just two more comments. One from Kathleen Cameron saying, thanks so much for sharing, Sherry. Your information is greatly appreciated. And Annette just saying, many thanks, Sherry. Greatly appreciate your personal story and your knowledge about the disease. And let's hope that you don't get Lyme disease again a fourth time.
Annette, if I get it a fourth time, I don't know. I maybe move into a concrete building and never leave it. And if anyone is interested in this presentation, if you felt there was information in there that you wanted to see, by all means, either shoot Shannon. Shannon, I think I can send her a copy and or shoot me an email and I will gladly send it out to you.
Excellent. So, all right. So I don't see anyone with their hands up. I don't see any new comments in the chat. So I think we owe Sherry, a very large thanks for taking the time today to share with us and tell her story and give some awareness to Lyme disease as well.
Well, thank you for listening, and everyone take care and be safe out there.
Absolutely agree. So with that, I want to thank everyone for participating today. We had a nice little crowd, and we're going to be having another branch event in June that you can watch for as well on the SIA website. So with that, I want to wish everyone a safe summer, and hopefully no one else, just with dealing with Lyme disease and wood tick. So have a safe summer, everyone, and we will see you at our next event. Thank you.
Thank you.